What is depression or major depressive disorder? It's a type of mood disorder where the patient experiences depressed mood throughout the entire day for at least 2 weeks. The patient usually suffers from something called anhedonia. And what is anhedonia? Anhedonia is the inability to enjoy activities that you previously used to enjoy. If you used to love playing football or playing soccer, you no longer enjoy these activities. That, by definition, is anhedonia. Patients typically feel fatigue, decreased energy, and for this purpose, you have to rule out hypothyroidism, so check the thyroid levels. There may be associated with psychomotor agitation or the inability to concentrate, feelings of hopelessness, helplessness, or even guilt. There's two different types of depression, typical depression and atypical depression. In the case of typical depression, you'll see the patient suffer from poor appetite, which leads to a subsequent weight loss of over 5% of the body weight. They often experience insomnia or poor sleep. But the case of atypical depression is completely opposite. While they are depressed, they do have a depressed mood throughout the entire day. They do experience anhedonia, but they instead have an increased appetite, which leads to a subsequent weight gain. They also have increased sleep, so they tend to sleep more throughout the day. Now, there are also certain risk factors that are associated with depression, and they are: it's typically seen more in females than it is in males. Usually around the age of 40 is the age of onset. Marital status plays an important role. If you're divorced, separated, if you don't have children, these are all risk factors for major depression. The patient typically has lower dopamine, serotonin, and norepinephrine levels. Another risk factor would be a family history of depression if your mother, father, uncle, close relative suffered from major depression. And exposure to certain stressors can lead to this: losing a job, a death in the family. Sometimes we get postpartum depression, which is after giving birth to a child. The treatment is, first, suicidal evaluation needs to be done. The patient needs to we need to rule out that the patient is not going to self-harm or has no desire to harm others. In the case of mild depression, maybe diet modifications and exercise may help by increasing endorphins. But in the case of pharmacotherapy, if it is needed, we typically use SSRIs, which are selective serotonin reuptake inhibitors, or SSNRIs, which are selective serotonin norepinephrine reuptake inhibitors, TCAs, which are tricyclic antidepressants, MOAIs, which are monoamine oxidase inhibitors. And in severe cases, if there is suicidal ideation and nothing else has worked, ECT or electroconvulsive therapy may be indicated. Differential diagnoses that are associated with depression are hypothyroidism, as we previously mentioned, Parkinson's, dementia. Some types of antihypertensive medications like beta blockers may lead to depression, pseudodementia, cerebrovascular accidents or CVAs, tumors, or other mood disorders like substance abuse, possibly sometimes post-grief. It may be just grief. So these are the differential diagnoses that we have for depression.